All right, guys. I am excited to be joining you guys today on this live. Now, listen, are you a mom with a baby who finds herself Googling at 2 a.m. some symptom or the other that her baby's having, and you're wondering if this is normal or not? Well, that's what we're going to be covering on today's video. We're going to cover a few of those things and symptoms and things that moms see that babies do that look weird or concerning. And so they are Googling, usually in the middle of the night, because they can't sleep and they're worried. And so we're going to cover those on today's live. My name is Dr. Obidi. If we haven't met, I'm a pediatrician at Partners in Pediatrics and Adult Care. And I have an amazing new mom community called Newborn Prep Academy. There's a link in the bio, where in the description, you can check that out, where we get to provide support for moms, especially new moms who are caring for new little ones and are worried about them, or just would love a place that is supportive, but where you also have a newborn expert that can help. That is a community for you. And so we're going to be talking about some of those things that moms have questions about and that keep them up at night. I mean, I completely relate with this, even as a pediatrician. When my wife and I had our first baby, I was petrified because there were all the symptoms and all the signs that the baby had, and I was like, well, I know I've read that before, but is that really okay? And but with years of experience, and at this point I've been practicing for 2 decades now, over 21, 22 years, and I've cared for over 3,000 babies and their moms. And so I've heard all the symptoms, I've seen them over and over again in the office, and so completely relates with every mom who worries about them. So let's talk about some of these, okay? The first we're going to talk about are hiccups. Now, have you seen a baby hiccup? It can be gruesome. Like, they are hiccuping away. You're so worried there's something wrong, or you're worried that they're in pain. And this can happen just time after time after time again. Well, this is very common for newborns. No one is actually sure exactly what causes hiccups in newborns. Now, I will tell you, first of all, that they usually affect us more than they affect the baby. The baby usually is hiccuping away and is usually not concerned as much as everyone else who is looking at them do it. But one of the thinking is that it's possible that when babies swallow a lot of air, that irritates the diaphragm, which is a muscle between your chest and your abdomen, and your belly and your stomach and intestines, and that sometimes is irritated and so contracts, and so a baby hiccups. So if that's the case, one of the things you could consider doing is making sure your baby is burping well. So when you're feeding, well, first of all, when your baby is feeding, making sure that they have a very good latch, whether that's when you're breastfeeding or you're bottle feeding, that there's a very firm latch and a very firm grasp of the nipple from your baby's mouth, so that there isn't a lot of air coming through, or they're not swallowing as much air. And you could consider burping your baby halfway through their feeding, just to get some of that air out and see if that helps the hiccups. But again, remember, those hiccups look way worse than they actually are. And so try not to worry when they're hiccuping away. Some communities have all kinds of different, what's the right word now? Different traditions that they do when a baby is hiccuping, that they think helps the hiccups. A lot of it is old wives' tales. I actually am of African descent, and in our communities back in Africa, in Nigeria specifically, where I'm from, a lot of communities will actually look for a string, a white string, and put that over the baby's head because it's supposed to really stop the hiccuping. And I've heard a number of my other moms from different ethnicities that have similar things that they do when the baby hiccups to try and stop it. But again, it's really harmless. Your baby is usually okay when that's happening. You don't have to do anything about it. So that is one of the symptoms moms uh, uh, Google about in the middle of the night to figure out if what's wrong with the baby. If that has happened to you and you're watching this, even as a replay, go ahead and put that in the comments. It'll be really cool to see how many moms have had to Google this in the middle of the night. Well, let's move on to symptom number 2 that moms tend to worry about a lot, and that is a baby who is sneezing. Now, this is another one that can be quite confusing for a new mom because up until that point, usually when someone is sneezing, it's because they actually either have allergies they're dealing with or they're sick. Now, this time of year, we're just about to get into spring. Things are beginning to warm up as at the time of the recording of this video. And this is a time of year when people are beginning to have the allergy symptoms sort of kick up. I've actually had quite a number of patients in the clinic this last couple of weeks whose allergies have been acting up. Family members of mine as well are having allergies kicking up right now. And so when you have a baby and you're sneezing a lot, sneezing, and sometimes it's several in a row, right? And so you're tempted to wonder if they have allergies or if they're sick, because that's the other time we typically have children and even adults sneezing when they're sick, right? You have all this secretions from your nose, and that sometimes can trigger those sneezing spells. But for a newborn, there's a different reason why they are sneezing. And it may not be what you think. So babies are called obligatory nose breathers, which means that they can only breathe through their nose in the first several weeks and couple of months after delivery. So what this means is that having clear nasal passages is very essential for your baby because that's how they breathe. And so if they're not able to breathe, that can be quite challenging for them. And so it's a reflex your baby has that when there's any secretion in the nose, they're going to sneeze to try and clear the passage out so they can breathe better. So when your baby is actually sneezing a lot, it's a good thing they're doing. It doesn't mean they're sick. It doesn't mean they have allergies. It just means that you most likely have secretions, either mucus or sometimes even just formula or milk when they've had a speed up episode. Some of that can track into the nasal passages, and all that irritates your baby's nose, and so they will sneeze to try and clear it out. So one thing you could do, especially if your baby is sneezing constantly, they sneeze a few episodes about here and there and they're fine, then just leave them alone because they just did what they had to do, which is clear their passages, right? But if it's constant, several in a row, and it's not stopping, one thing you could do is put some saline drops into your nostrils and then use a bulb suction to suction that out, because that will clear their passages and help them breathe a little better, and also just take care of the sneezing typically. So there you have it. Number 2 symptom that moms tend to Google in the middle of the night, wondering if this is okay. And a quick reminder that sneezing in a newborn typically does not mean that they have allergies. It just means that they have secretions in the nostrils that they need to clear so they can breathe, which is a good thing. We do want our babies breathing, don't we? All right, but that leads me though to the other symptom that can be quite worrisome for a lot of moms, and that is a baby who's spitting up a lot, right? So this is a very tricky one, and we're going to talk about it because oftentimes it's normal and there's nothing that needs to be done, and then sometimes it is an issue, and we'll talk about when to worry about that. Okay, so again, this is a baby who is spitting up, and when is it normal and when is it not? So first of all, speed ups will happen when there's just some relaxing of your baby's of the sphincter. So so that's the valve, if you will, around your baby's stomach, and so it relaxes a little bit, and some formula or milk, whatever they're feeding, comes up, and is spat out, right? So that's a speed up. Now they may also have some vomiting, so maybe a little bit more forceful, but it's typical for newborns to have some degree of reflux happening where they're spitting up, right? And so that can happen a few times a day. Some babies maybe a little bit more, but you know that this is more of an issue when a number of these things happen. When your baby is not putting on weight and they are spitting up more than 50% of the time after they're feeding, and which is important, and they're not putting on weight, because some babies just speed up every time they eat, but they're putting on weight and there's not an issue. So that's why it's very important for you to keep those appointments with your baby's pediatrician so they can track their weight and see if they are putting on weight appropriately. And if not, then we can intervene. So again, if they're not putting on weight and they're doing a lot of speed ups, that can be concerning, and so have to be looked into. The other thing that you'll see when there is speed ups that are worrisome is that your baby is usually very uncomfortable when it happens. Now, a lot of babies, when they speed up, it comes out their mouth. They don't even seem like they're bothered. They don't seem like anything happened. Those are typical for most babies. However, for babies who have some significant reflux or acid reflux issue, when they spit up, because it's acidic and it can be very uncomfortable. And so babies may make a face and just be very uncomfortable when it happens. They may arch their back when that's happening, and also just crying a lot of times. When that's happening with spit ups, then that's concerning, because there may be more than just regular speed ups going on. It may be something more like acid reflux. And so you do want to follow up with your baby's pediatrician to make sure, excuse me, that there isn't something more serious going on. Okay. All right. So that's speed up. That's again one of those symptoms that moms will Google and worry about to see if that is a normal symptom or not. So for most babies, for a lot of babies, it is normal for them to speed up here and there during the course of the day as they feed. And usually they're growing just fine. They don't seem bothered by the speed up. And it's more of an inconvenience because of all the clothes you have to change, but really doesn't affect your baby's health or growth. And so try not to worry if they're doing just fine. But if there are any of those warning symptoms, or they speed up and there's blood in it, those are obviously worrisome symptoms, and you should have that checked out by a pediatrician to make sure everything is okay. So we're going to cover one more. We're going to cover one more symptom moms worry about, and that is when the baby has noisy breathing. So this again is another tricky one, because a lot of babies do make all kinds of noises when they're breathing, right? Sometimes during periods of the day, some gurgling noises, just very sort of stuffy sounding noise when they're breathing. That can happen for a number of babies, and that typically will happen sometimes because they've had some speed up and there's still some mucus in the nostrils, or anything really that's in the nostrils, because the nostrils are very tiny. Any mucus in there or any particles in there will cause your baby to just sound very nasal and very noisy. And so that can be one of the reasons why babies will just sound that way when they are breathing. The other reason is sometimes they may have what's called laryngomalacia, which is basically where the pharynx, or the larynx, the back of the baby's throat, is not very firm. And so when they're breathing, the airflow, if I can kind of go to my side right now, the airflow in and out doesn't go very smoothly in and out. It's very turbulent. So it's sort of is a very disruptive movement. And so that just makes a lot of noise when your baby is breathing. A lot of babies who have laryngomalacia, it's very mild, and so it usually doesn't affect their growth, doesn't affect their breathing. It's just this noise that you hear every now and then, especially the very active, that you may just hear that. But otherwise, they're usually okay. When it's a more severe form of laryngomalacia, there's so much collapsing going on when they're breathing, so it is affecting air movement in and out of their lungs, and they are using a lot of energy, expending a lot of energy to breathe. And so those babies typically not putting on weight very well, just look very distressed when they're breathing. And so you definitely want to take them to get some medical attention. Otherwise, most times babies are fine. Again, you want to check with your pediatrician, check with your provider, make sure there's nothing else going on. But oftentimes, at the end of the day, this is just a baby who's just noisy and just sounds very nasally when they're breathing, and that's usually okay. So again, signs to be worrisome would be your baby is not growing, your baby looks very distressed when you're breathing, it's very fast, they're also breathing very fast, and it's a sustained fast breathing. That's usually concerning. You want to make sure you're checking them checked out. But otherwise, if your baby just sounds just a little nasally when they're breathing, that typically is okay. But again, you do want to get it checked out to make sure everything's okay. But usually most babies are fine. So there you have it. There are many more symptoms. We're going to cover those on a different live, but I just wanted to hop on here to cover some of these common symptoms that new moms tend to worry about, that they when their babies are exhibiting any of these, but most times they really don't have to worry. So if you will love more information like this, more support like this, that's why I put together our Newborn Prep Academy community. It's a community for our moms, especially new moms or expectant moms. So you're, about to deliver and you're just worried about all the things about your baby. Oftentimes moms worry about the clothing they're going to buy and setting up the baby's nursery and all of those things. And but at the end of the day, the things that really cause a lot of worry for moms are just understanding their babies and understanding all these behaviors, trying to understand what's normal and what's not, when they should worry, when they should not. And just lots of tips when it comes to just caring for your baby. And those are the things we cover in the newborn preparation community. There should be a link in the description where you can click and come check it out. There's a free trial for 7 days. Otherwise, it's seven at the recording of this video, $7 a month, which comes to really about 25 cents a quarter a day, a very small price to pay for just the support of having other moms in the group with you, moms that can get to really share that journey with you. And just as important, having a pediatrician in the group that you can ask questions of and can provide lots of content. In the group, there's a classroom area where I have some courses available for you to just get through at your own pace. There's a baby's essential masterclass and the newborn preparation course, and they cover things like feeding your baby and sleep training and sleep issues, and how to care for your baby's circumcision site and how to care for their umbilical stump and that area, what to expect when the baby is born at the hospital, and all the things that they get to do with the baby just so you're prepared. How to prepare for your own mental health and how to just manage that, how to get the help that you need. We cover all of those and more in the newborn preparation course and the baby essentials masterclass. How to choose the right pediatrician. These are lots of topics and many more that we cover in the content, and it's just available in the community that you can just really consume at your own pace. I also, and this is really cool, I also go live on the community once a week, which is where I can just hang out with our moms and they can get to ask questions. We can just get to sort of talk about their babies and what's going on. And that's just invaluable. And I enjoy doing that because I do that all day long at the office and enjoy interacting with new moms and your babies. So I can't wait to see you in the newborn preparation, in the Newborn Prep Academy community. Come join us. It'll be a wonderful time. I am creating this space with moms and in a partnership with moms. So they're helping to shape what the community is going to look like. So come join us as a founding member. You'll really enjoy it. I can't wait to care for you there. If you have any questions you'd love me to cover on these lives or any of my videos, go ahead and put it in the chat. I'll come by and check it out and create some content around it. All right. Hope you enjoyed the video, and I'll see you on the next one. Bye now.